Dr. Michael Ryan with Missouri Vein Care talking about the topic of foot symptoms and whether they can be related to a vein condition. The short answer is yes, they often can be related to a vein condition, but not always, and it takes a little sorting out. Symptoms that we typically see that are related to a vein condition include numbness, tingling, stinging, burning, itching, and cold feet. And usually it's a pattern that we see that's in the lower calf and involves the foot. So if it's just the calf and not the foot, then it's probably not going to be from your veins. So it's always in the furthest part of the extremity, in your feet and toes. The other pattern that we see that really suggests that it's a vein condition is that the pattern is that the symptom gets worse in the evening or at night. This is something that's difficult for some people to sort out because they're not really clued into focusing on that the way we as health professionals do. But one of the things you can ask yourself is, do I notice it more in the evening or in the morning? Because you may not have a way of grading the degree of discomfort or irritation or whatever the symptom is. But if it's something you're aware of in the evening but not in the morning, well, that means it's more prominent in the evening. That suggests that it's coming from the veins, um, and that vein treatments will help. Um, so the other thing that we look at is there any evidence of the similar symptoms in the hands? If people have symptoms in their hands and their feet, it's unlikely to be related to the veins, and it's more likely to be something related to what's called neuropathy, which is usually a difficult diagnosis to pin down, but it's a not it's a non-specific uh, condition involving the nerves in the periphery. So people with neuropathy typically have symptoms that are 24/7. They don't change. They don't get better. They don't get worse. They wake up with the problem. They experience the same all day. In the evening, it's the same as in the morning. Those people have a constant pattern of their symptoms, and that is not what we would expect in a vein condition. And normally, we don't advise people that vein treatments will help those symptoms. Those people may have other symptoms that are related to their veins, like aching or cramps that get better. But I will tell them that their foot symptoms likely in that situation will not respond to treatment. What we're looking for is the pattern where the symptoms are more prominent in the evening, including cold feet. Those symptoms do get better with a vein treatment. Now, what's the next step? The next step is to find out if you have a vein condition. The best next step is to get a vein reflex ultrasound, which shows the function of the veins under the surface of the skin. Those are the veins that are causing the problem. And that is done standing up. So if you have a vein reflex ultrasound, standing up allows the abnormal function of the veins to be demonstrated. Most labs will get a blood clot or DVT ultrasound, which is laying down, and you're not going to be able to see that vein abnormality, and the diagnosis will be missed. So you want to make sure that that is what you get. Seeing a vein specialist will help as well. Normally, people that have foot symptoms with a vein condition also have other symptoms in their legs: aching, fatigue, cramps, restless legs. Not necessarily all of them, but some of them. So normally there's a combination of symptoms that we expect to see, uh, and that's how I evaluate individuals and make my recommendations. I try my best to give people my prediction of whether a treatment will help them, and this is how I do it. And I must say that I feel like that pattern recognition has really made a big difference in my ability to advise people on whether a treatment will help them. So, Dr. Michael Ryan talking about whether foot symptoms are related to a vein condition.